The world is facing another major public health crisis. I'm not talking about another virus or flu. It's something much more prevalent. I'm talking about obesity. The World Health Organization is trying to deal with it. It is considering including obesity-combating drugs in its essential medicines list. A panel will be coming up with a decision next month. So what exactly are these drugs and how do they work? One of them is called Saxenda. It is a once daily injection. It helps people reduce 5% to 10% of their body weight. It costs $450 per month in the US and $150 per month in the UK. Another one is Wigovi. It is a weekly injection. It costs $1,300 a month in the US. Users have reported losing up to 15% of their body weight. You see, these medicines come with exorbitant price tags. Third world countries cannot afford them. So what happens when these drugs make it to the World Health Organization's list? They would become more accessible to the low and middle income countries. More governments would source them and more people would be able to consume them. While the WHO's decision could be a small win, we cannot ignore the fact that prevention is better than cure. What the WHO is aiming to do would cure this problem, but it cannot by far reduce it. Have a look at these numbers. Globally, more than 2.8 million people die due to obesity every year. Around 1.3 billion adults are overweight. 650 million of them are obese. 39 million children under the age of 5 were overweight or obese in the year 2020. Over half of obese people live in just 10 countries. They are the US, China, India, Russia, Brazil, Mexico, Egypt, Germany, Pakistan, and Indonesia. Did you notice something? Most of these countries are low or middle income countries. It shows that poverty is one of the biggest drivers when it comes to obesity. And why is that? Because people with meager incomes cannot buy healthy food. So they make do with cheap fast food. If you visit these countries, you will find cheap stands in every nook and cranny, offering inexpensive food with no nutritional value. How can providing obesity medicines be enough then? The WHO's move does not quite cut it. And the scary part is, the rates of obesity are continuously rising. They are particularly bad among children and in the third world countries. The World Obesity Federation predicts that more than 4 billion people will be obese or overweight within the next 12 years. Can you imagine that? That is more than half of the world's total population. These people will be at risk of hypertension, high cholesterol, type 2 diabetes, stroke, coronary heart diseases, gallbladder diseases, sleep apnea, breathing issues, you name it, the list goes on. Obesity is not only a healthcare issue, it is also an economic problem. Studies, after all, show that obese people are more likely to be less productive at work. They also take more sick leaves as compared to non-obese employees. If 51% of the world's population is on the path to being obese, there would be a dip in productivity. What would that mean for the economy? While the WHO's move could help tackle the problem, it is a far cry from a long-term solution. Instead of focusing on drugs, maybe it should focus on ways to prevent obesity. The issue needs to be addressed at the grassroots level. WION now available in your country. Download the app now. Get all the updates on the move.